So today the question is, are belly bands safe, especially in pregnancy? Now, the question comes up time and time again. There's always a question of what belly band to use, whether it's safe or not, whether it can cause harm or not, what it can and cannot prevent, what it can and cannot do. So I'm here to just give you a bit of a breakdown on what this belly band could be beneficial for and what could be problems that arise from it. Going back to that first part of the question, are belly bands safe? Now, it depends on why you're using a belly band. So in general, the use of a belly band after some sort of abdominal procedure or even a chest procedure, so if you've had open heart surgery and things like that, there is reason and good support behind using a belly band initially to aid with moving around. So incisions that are coming along that midsection or cuts that are coming along your surgical scar along that midsection, coming all the way down to the C-section, yes. In the beginning, you're going to get some benefit from that belly band or that abdominal binder, however you call it, to be able to support your muscles that have just been traumatized. And let's face it, it may not have been a fight, a stab, but surgery is still feeling like trauma to the body. It's controlled trauma at this point in time. So with that type of injury that needs healing, using a belly band in the initial stages to help support you as you move around can be a beneficial thing. However, there comes a point in time where we need to fade away from it. And that's going to be determined on what the pain levels are like. So if you are still wearing your belly band 6 weeks later, 8 weeks later, we probably have a bit of a problem. Let's back it up a little bit. The question about it being safe during pregnancy. An abdominal binder during pregnancy isn't going to stop things like stretch marks or a diastasis or any of those things. What it can do when you're pregnant is help to give support to that growing fetus that your muscles alone don't have to do. So you can have support for that growing belly with the use of an abdominal binder or a pregnancy support belt, and there are different versions that can give different support. Some are going to do a little bit of a lift of the belly with just the way it's placed around the lower half of the belly when you're pregnant. Some may have straps that come over the shoulder to give a little bit more of that support. And some may have pieces that come between the legs for different reasons. Y'all don't need to know all about that unless you really have the issue. Come back and talk to me. However, you want to make sure that it's not something that is so constricting, but more supportive. And you have to know the difference. If something is just squashing you in like that, that's restricting. If it is lifting, it's supporting, and it feels like it relieves the tension that can come to the back, now we have something that is supportive. So you don't want to be wearing your Spanx at 9 months pregnant. That is not appropriate. That is constricting. Versus the belly bands, the mama braces, or however they call them, that are going to lift and support the belly a little bit. And you use it for different diagnoses. Sometimes it's to help relieve the back pain. Sometimes it's because you're having pubic symphysis pain and you want to relieve some of the pressure that's there. There are different reasons why you would use it within the pregnancy. No, it should not be a harm to the baby, because you are gently supporting the environment that the baby's in. And we have to also remember that the baby's not just floating in there alone. The baby is very much protected in that amniotic sac. There's cushioning and there's padding and there's reasons why we're created that way with protection for the baby. You want to make sure that you're also protecting you as you're going along. Now, that's what would happen when you're in pregnancy, and appropriate uses of belly banding or banding, if you want to call it, in the pregnancy. Now we've delivered. Let's imagine we've delivered and it's a vaginal delivery. If it's a vaginal delivery and you've had no real increase in pain in the, I should say abnormal pain, excuse me, no increase in abnormal pain along the bones at the front by your pubic symphysis or the bones in the back where your spine and your hips meet, if you're not having any significant abnormal pain through there, a regular supportive underwear may be okay. Not having to go in and do this banding of the belly and tying things so tight that it now becomes restrictive. We have a bit of that snapback culture, and we need to understand that that is not always an appropriate thing. It's not appropriate, and it can be dangerous. It can be counterproductive to the rest of the system. So you may be getting that reduction in what you think looks like your belly size, but you're putting pressure in areas that doesn't need the pressure, right? And one of the examples I could say would be this. When we put too much pressure at the abdomen, because of that intra-abdominal pressure that is sustained or it's maintained by the diaphragm, which is at the top where we breathe, the pelvic floor at the bottom, and the walls of the house being the muscles in the abdomen and the muscles at the back. If you go in now and you stifle off movement at the abdominal muscles, and you're not letting them get any of the way that they need to go, that pressure that comes in just from us breathing, just from us lifting, moving, doing, being, it has to go somewhere. And it starts to put undue pressure into the other parts of the system. Sometimes that leads to back pain. Sometimes that leads to pelvic floor dysfunction. So we want to make sure that we're not creating more of a problem by trying to cut off and restrict the motion in there. One of the important things about post-pregnancy is, with a lot of these changes that happen in our body, in our system, our rib cages tend to lift and flare up and out to be able to give the belly room to grow. And so now if we are maintaining that position, it's up and out. That means the diaphragm is not dropping as well. And then we go and we tighten it off with a band and we're suctioning that in tight. Where is all of that pressure going to go? It's literally going to go down to the pelvic floor, and you can start to have more dysfunction down there. You can start to have weakness. You can start to have symptoms that look like prolapse and pain and all these other things. So we want to make sure that we're not creating additional problems after the fact. Now, that is after having had a vaginal delivery, right? Not necessary. If we have had a C-section now, and I say this from experience, that binder can be magical. It can be quite magical because it gives you some of the support that you don't even feel that you have. After the epidural is worn off a little bit, you're still numb in the area. You don't even know how to go about doing anything yet without fear of ripping up everything. So it can be helpful in the first couple of weeks as you're learning to move and as you're learning to get about. But there comes a point in time where we need to move away from it. One of the most important concepts within our body, I like to call it our plasticity. Our human body is so good at adapting to things, period, right? Making changes to accommodate certain things. Those can be good changes and they can be bad changes, right? We can get into bad habits and keep those bad habits and keep going with them. But we can also get into good habits, make changes, and keep going down that road, right? So one of the good things that can happen is we can heal. That's the adaptation, right? And with rehabilitation, professionals, physical therapists, occupational therapists, speech therapists, things like that, they're looking to maximize how you're going to be able to heal and retrain the system to get back to the better habits. Now, if you go on and rely on a brace for months and months on end, and you're continuing to wear this thing and you're binding and you're holding and you have now asked the stomach muscles, the back muscles to basically turn off. They're saying, oh, I no longer have to do that work. There's something doing it for me. I'll send all my energies over to something else. We don't have to do anything here today, y'all. And when I tell you, I have literally seen it. I've had a patient, and this was not a back or belly, this was a knee, that had worn a brace on her knee for over 5 years every single day. She had no real knee. It was almost half the size of the other leg. She had a permanent suntan on it. This was in Florida. She had a permanent suntan on it, and she could not take but 1 or 2 steps without the brace, without her leg buckling, because she had become so dependent upon the brace, her muscles almost atrophied to nothing. And that term atrophy means disappear, basically, right? They thin down. They're not of use, so the brain stops feeding them. The brain stops really sending things to them. The brain stops trying to activate them. You do not want that happening to your muscles. Back, belly, butt, none of it. Because you need these muscles to be able to hold you and keep you. These are the muscles that have to keep your posture. They have to keep you well supported to be able to do all the things that you need to do. So one of the better things is use it for the time when it's urgent, when it's very much needed, but try weaning away from it over time so that you can start engaging the muscles and asking your body to go back to do its work. Now, one of the things that can be helpful even early on in the pregnancy stage, and a lot of times people are very wary of it, like, oh, why would I exercise? And we've talked about this in previous videos, but engaging the stomach muscles even while you're pregnant, toning those muscles to understand that, yes, I'm asking you to stretch to this unfathomable length to get this baby to term, but I still need you to engage. I still need you to be working so that after this baby is gone, you can go back to your job of keeping me, of supporting me, and of doing these things. So engaging the muscles while you are pregnant, doing simple exercises. And please do not come tell me you're trying to do sit-ups. I don't know where you're trying to do sit-ups to go. That's not what we're talking about. If you don't know what to do, seek a professional, right? There are physical therapists who would be very, very glad to put you through a routine to help keep you conditioned. So we want to be able to start engaging those muscles early on in the process to do the job that they're needing to do so that we do not have this over-reliance on bracing and the binding. Now, I know for some people, there's probably a cultural component to it, right? And I'm not speaking to the cultural component of, whether it's the healing herbs that are placed on the belly as it's wound or bound, whatever the case may be. What we don't want is for there to be restriction. We don't want it to get to the point where you're having to breathe like this and into your chest, and you cannot take a full breath into that belly because it's bound so tight. That is not going to be helpful. You want to do things that are going to promote healing. And so not only do we not want to have this binder on all the time over our incisions, we want to make sure that they're able to remain appropriately dry. So we don't want them dried out and cracking. We also don't want them to be too moist and wet where the term would be macerated and it starts to get sticky. That's not proper healing environment either. But one of the best things you can do to help with healing is to continue to get good blood flow into the area. So simple exercises, good breathing techniques, where you're getting that belly muscle to expand and deflate over time, right? For a better word. Those are going to be good activities that are going to bring blood flow into the area, which can help with the healing of the wounds. Okay. Now, we've had the baby. We've recovered from the C-section. Let's go on to this new trend that I'm seeing, hearing about corsetting. Y'all, we are not in the Victorian era. We are not. I don't even think they knew what they were doing then. Please. I've heard that even men are starting to corset. I mean, no, y'all, we have enough pelvic floor issues. We don't need to add any more to it that way. Now, the thought may be, yeah, do men have pelvic floor issues? Well, do they have a pelvic floor? Yes. So they can have the issues as well. Same way we have pelvic floor, we can have pelvic floor issues. The corset goes along the same lines of that belly band. Now, let's imagine you are doing cosplay and you are going dressed as a character from Bridgerton. Okay, you want to get dressed, you're going out for the night, you decide you're going to wear the corset, understand you may be quite uncomfortable, It's a period of time, you move on from it. But as a daily constant activity, it's the same thing. If that corset is holding you that tight and doing all that work of supporting your posture, guess what? You are asking your muscles to turn off. Same way. And one of the biggest issues with that becomes having messed up with that intra-abdominal pressure, you are now putting all of that pressure down onto the pelvic floor. Squeezing of muscles up to the top, like right under your rib cage and at your chest, when you have a lot of compression into those muscles there, any small change in the diaphragm is going to push everything down, and it pushes it on the pelvic floor. It just increases the pressure on the pelvic floor. And these are some of the things that you can find happening with people who have prolapse. So you do not want to risk being cute for now having issues in your 50s, 60s, 70s, because you've been doing this for so long and you've now stretched out all the internal contents that you have going on. So all of this to say, abdominal binding, belly banding, they can be safe in a small population post-surgically for a limited period of time. If you have any questions, you follow up with your medical providers, you find a physical therapist, specifically a pelvic floor physical therapist that can give you more information. And remember that this information is not medical advice. It is for education and self-advocacy purpose. I want you to know, I want you to be able to have the information to ask the right questions to get what's needed for you specific. This is Trisa Job, Doctor of Physical Therapy, pelvic floor therapist, signing off for Healthy Bump Club. And if you want to reach out to me, you can find me on IG at trisajob.dpt.